stepped up testing efforts and less social interactions, an expert tells us if these new measures are enough to slow down the virus spread.
To combat the Delta variant, Singapore cannot rely solely on vaccines, says NCID's director.
In a world first, Cuba has started vaccinating kids from 2 years old.
You're watching The Big Story, coming to you live from the Straits Times newsroom. I'm Olivia Quay.
I'm Haryanto Diman. You can subscribe to the Straits Times channel so you never miss a single episode. 1,000 cases a day in 2 weeks. 2,000 in a month. Now that's the projection Finance Minister Lawrence Wong made last night if COVID-19 continues to spread in the community at the current rate.
The number of new local cases nearly doubled to more than 1,200 last week. But what concerns the authorities are not these absolute numbers. Rather, it's the virus's reproduction rate, or R, which is currently above 1.
We know from the experience of other countries that when cases rise so sharply, there will be many more ICU cases and also people succumbing to the virus. It's not just the unvaccinated seniors, because even for vaccinated persons, there will be a small proportion of them falling severely ill. And if you have a very high infection caseload, that small proportion will translate to a sizable number of ICU cases and eventually fatalities. So we have to slow down the transmission rate and bring R down. We will attempt to do so without going back to another heightened alert. And in particular, we will go for aggressive contact tracing and ring fencing of cases and clusters and push for more pervasive testing.
And so workers in more sectors, including public transport frontline staff and supermarket workers, must undergo mandatory fast and easy rostered routine testing. These will be done more frequently, from once a fortnight to once a week.
The government will also issue to all other companies 8 ART kits per employee. On-site staff members are expected to do weekly testing over a 2-month period.
As for ring fencing, when new clusters are detected, health risk warnings and health risk alerts will be issued to exposed people. There are different actionable steps for each, but individuals on either should reduce their social interactions for 14 days.
What do the experts think of the new measures? Joining us now is Professor Leo Fisher, Senior Consultant at NUH's Division of Infectious Diseases. Welcome back to the show, Professor. Are the measures announced yesterday to slow down the community spread enough, Professor, since most of it is self-directed, own self, check own self, in other words?
Yeah, thanks, Haryanto. Listen, I think we need to keep going back to what the strategy is. And the strategy as we transition into endemicity is to prevent severe illness and death. And obviously at the same time protect hospitals from being overwhelmed. It isn't to stop spread, and we need to get a bit more comfortable with the case numbers, but because we've got a vaccine that doesn't block transmission, so this is why we need to talk about endemicity rather than eradication. So in the future, not too distant future, we will be treating this like the cold or flu. We won't track every case, we won't diagnose every case, and we know that COVID, like these other viruses, will just circulate freely, but be quite mild in that sense, not like COVID was in the pre-vaccination period. So I understand why these new measures are in place, though. This, I guess, personal responsibility to try and limit transmission, and this is because as we try and transit, we want to do that gradually. We know the case numbers will go up, and we want to see what the impact of those case numbers going up is on hospitalizations and severe disease. But it's just going a bit fast. I think it's going a bit faster than any of us thought. The numbers have doubled over the last week, and that doesn't give us time to monitor. So this is why, without bringing in new rules, the authorities have just said, can everyone just try, decrease your activities, slow things down a bit, let's buy some time so that we can gauge the impact of these high numbers.
Well, Prof, Given what you've just said, while restrictions are said to be necessary to bring down infections, it doesn't sound like we're treating the disease as endemic. So do you think it's time to reassess our strategy here to becoming COVID-19 resilient?
Yeah, I don't think, Olivia, that the strategy has changed. At least I hope it hasn't. The most important thing is that we don't get too distracted by case numbers, but it's okay to look at it in terms of a rate. And as I said, the rate's going too quickly. We knew the rate would go up, but think about it. There's probably 5,000 or 10,000 flus or colds every day in Singapore normally. Of course, there's been none during COVID because of the measures, but this is how it normally happens, and we don't count them. What we do count with flu is the types of flu and how it's evolving genetically, and the severe cases, and that's really got to be our endpoint with COVID. I am concerned that some people are going to get too concerned over the number of cases. The number of cases used to matter, but now it matters a lot less, and eventually it won't matter at all. The disease in vaccinated people is very mild, and in fact, we wouldn't have, what we've done over the last year and a half, we wouldn't have done that if COVID was like a cold or a flu. We did it because it was very severe. Now it's less severe, so now we need to adjust that balance in time.
Professor, let's talk more broadly. We have vaccines, we have safe management measures, but numbers are increasing. Of course, you mentioned that eventually these wouldn't matter as much anymore. Have we exhausted our options in this fight?
The fight is to prevent severe disease and deaths. That is most successfully done with the vaccine. So, of course, we need to be looking for vaccine waning. I'm not convinced that we're actually seeing that yet globally, at least not in a clinical sense. There's also a handful of people that are still not vaccinated, and it'll be very important to still try and mop up, if you like, these last few people, whether I think there's maybe 10% of the over 12s are still unvaccinated, and to try and find those people, help them understand that the COVID vaccine is a lot better than COVID, which is somewhat inevitable if you're unvaccinated. So I think that's probably the most important thing in the armament. The other thing is, as I've alluded to earlier, is this mindset change that's really important. Every time we've gone into a new phase of this pandemic, from the first time we closed borders to put our mask on for a first time, this all required a change, an adjustment into how we were going to behave. And now it's time for us to get used to the next phase, which is getting used to the case numbers, or ideally not even count them and focus on things that matter, like numbers in hospital.
Right. Well, Prof, in Singapore, the Delta variant's reproduction rate, or R0, is slightly more than 1. This is also something Minister Lawrence Wong said yesterday. Overseas, Delta's R range is between 5 and 8. So Singapore's R value is comparatively lower. What's your take on that?
Ultimately, we need to not care so much about transmission. Stopping transmission was critical in the pre-vaccination phase. That was our only tool to stop people getting disease, getting severe disease and dying. But now, stopping asymptomatic transmission is actually much less important. It's about having people vaccinated so that when they get infection, it's very mild. In fact, actually, Olivia, it's quite reasonable to consider that if you're vaccinated and you get asymptomatic COVID on top of that, then in a way that's a booster. So that's actually enhancing your future immunity. So it's kind of a good thing. It's complicated.
Well, Professor, nonetheless, we appreciate you coming on the show to give everything some perspective. We've been speaking with Professor Dale Fisher, a senior infectious diseases consultant at NUH.
Thanks, guys.
From tomorrow, seniors can get free SINOPHARM vaccines at Healthway Clinics, which has tied up with real estate OUE to sponsor vaccination.
This will benefit 1,000 seniors who are 60 years old and above as at September the 1st. They can register online, and those who have previously registered their interest with Healthway have been invited to book their appointments.
Overseas, Cuba has started to vaccinate children from 2 years old, the first country in the world to open jabs to this age group. Using homegrown jabs not recognized by WHO, the island aims to inoculate all its children before reopening schools, after an explosion in infections in recent months.
From September 15th, Hong Kong will allow visitors from mainland China to skip the strict quarantine process required for most arrivals. Under the Come to HK travel program, 2,000 non-residents from the mainland and Macau can come into Hong Kong each day. Hong Kong will also resume its Return to HK program tomorrow, allowing its residents from China to return without quarantine.
When it comes to combating the Delta variant, one thing has become clear: vaccination is not enough. National Centre for Infectious Diseases Director Professor Leo Yee Sin said this in an exclusive with the Straits Times, commemorating the centre's second anniversary.
So this means Singapore cannot let up in its fight against the disease, even if we have gotten both vaccine doses. Prof Leo said we should still wear our masks, clean our hands, and generally keep our guard up.
Our colleague, political correspondent Linette Lai shares more from her exclusive with Prof Leo.
As we know, vaccines are only 40% effective against the Delta variant. So in other words, what this means is that if there are 10 people, all are vaccinated, 4 will be protected against infection, and the other 6, they may have a chance of getting COVID. And so at this point, you might be thinking, okay, so I'm infected, but so what? Because I'm vaccinated, I probably won't even fall severely ill. Maybe I don't even know I have the virus. But that's exactly the point. Because even though you may be asymptomatic, you may be mildly symptomatic, but you can still transmit the virus. You can still spread it to other people. And none of us really lives in a bubble, right? So even though your household members may all be vaccinated, your colleagues at work may all be vaccinated, but maybe you're taking a 30-minute bus ride with someone who is not vaccinated, or maybe they have people at home who are not vaccinated because, they're not eligible for vaccination, or maybe they're very young children at home, and you can spread it to them, and that is really how the virus spreads. And so that's a problem right there. That is why just because we have vaccination doesn't mean we can relax.
Well, many thanks to you, Linette. You can read her exclusive with NCID's Director, Professor Leo Yee Sin, at straitstimes.com or in tomorrow's paper.
A quick wrap of other headlines. According to IMDA, the online citizen has repeatedly not declared all its funding sources for last year, despite reminders and extensions. It's also been asked to explain its non-compliance, and if unable to provide good reasons, IMDA may take, quote, appropriate enforcement action without elaborating. IMDA said TOC has stated its intention to not comply with its obligations under the law, adding there is no reason for the media outlet to not comply the declaration requirement. This because other registered internet content providers give such information to maintain transparency of their funding sources.
6 people, including outlet operators, are being investigated following police raids on 10 massage establishments between August 26th and September the 2nd. Operating in Ang Mo Kio, Jalan Selaseh, Simon Road and Upper Serangoon Road, 6 outlets committed various offences under the Massage Establishments Act, while 4 were allegedly running without valid licences. Vice-related activities were purportedly detected at 2 other outlets.
In sports, fans going to the hallowed grounds of Old Trafford will get their COVID-19 status checked, with the new measures set to be introduced this Saturday at Manchester United's game with Newcastle. Those above 18 must show that they are either fully vaccinated or have received a negative PCR or lateral flow test result within 48 hours of kickoff.
Those are our top stories for today. For more news and videos, visit straitstimes.com and subscribe to our YouTube channel by hitting the red button below.
Once again, I'm Haryanto Diman with Olivia Quay. Join us tomorrow for more stories on The Big Story.